Hey guys, today we will be talking a little bit about bronchitis, some effect it has on the body, and how to manage this disease. Hope you enjoy. This information is brought to you by Brianna Chavez, Tom Hoying, Elizabeth Johnson, and Brittany Parsley. This is a picture of what your lungs look like when they are inflamed and full of mucus. A little bit of background on acute bronchitis would be it is a short, self-limiting time period in which there is inflammation of the bronchi in the lower respiratory tract, which consists of the lungs. Being seen for bronchitis is a common occurrence. Acute bronchitis is mostly due to viruses. Etiologies that are less common can include pollen, chronic sinusitis, dust, inhalation of chemicals, pollution, pet dander, and smoke. Asthma, as well as asthma triggers, can cause acute bronchitis. If symptoms such as coughing and sputum persist for more than 3 months or 2 consecutive years, it then becomes chronic bronchitis. Airflow limitation, such as bed rest or inflammation, often precede bronchitis.
Some subjective symptoms can include a general feeling of fatigue, a headache, chest pain, and malaise, which means a general feeling of discomfort or illness. The client may be unable to identify what is causing this feeling. They may also complain of myalgia, which is the soreness and achiness in the muscle, as well as dyspnea, which means difficult or labored breathing. Some objective symptoms include a persistent cough that lasts up to 3 weeks. Sputum production is often present and is typically clear. However, it can become purulent and colored. This does not always indicate infection. Lung sounds may be clear but can also present with crackles or wheezing. Abnormal lung sounds are typically heard when breathing in. The patient may also be experiencing fever and have a hoarse voice. Acute bronchitis is most commonly associated with viruses, but it is also associated with inhalation of chemicals, smoke exposure, asthma exacerbation, air pollution, and chronic sinusitis. Therefore, acute bronchitis is clinically diagnosed and includes determining the underlying trigger. A physical examination with a focus on auscultation of lung sounds and a persistent cough lasting more than 3 weeks are common indicators. Accessory muscle use, a persistent cough with or without sputum production, hypoxia, and audible wheezes upon auscultation of lungs are indicative of bronchitis. If sputum is produced with coughing, then a sputum culture may be taken to determine if the acute bronchitis is a result of a bacterial infection. A chest x-ray would not show signs of acute bronchitis, but is helpful in ruling out pneumonia, which, if the chest x-ray is negative, helps in determining the diagnosis of acute bronchitis. If there is a persistent cough of 3 months or more for 2 consecutive years, then this may be indicative of chronic bronchitis. Chronic bronchitis is also clinically diagnosed, but there are other diagnostic studies and tests that show more tangible results indicating chronic bronchitis. Pulmonary function tests measure airway and ventilation limitations that are not reversible. A persistent pulmonary function insufficiency is indicative of chronic bronchitis. Blood gas tests suggestive of chronic bronchitis that include, but are not limited to, are chronic high levels of CO2 and low levels of oxygen.
The goal in acute bronchitis is to relieve symptoms and prevent pneumonia. Treatment is supportive, including cough suppressants, encouraging oral fluid intake, and using a humidifier. Beta-2 agonists such as bronchodilator inhalers are useful for patients with wheezes. Generally, antibiotics are not prescribed for treating a viral infection, as they may cause side effects and promote antibiotic resistance. However, antibiotics may be prescribed for patients with underlying chronic conditions who have prolonged infections associated with systemic symptoms. Patients should be encouraged not to smoke, avoid secondhand smoke, and to frequently wash their hands. Bronchodilator medications are inhaled as aerosol sprays or taken orally. Bronchodilator medications may help to relieve symptoms of chronic bronchitis by relaxing and opening the air passages in the lungs. Steroids are inhaled as an aerosol spray. Steroids can help relieve symptoms of chronic bronchitis. Some side effects of bronchodilators would be nausea, vomiting, diarrhea, palpitations, a rapid heartbeat, and an irregular heartbeat. Some side effects of cough suppressants would be drowsiness, dizziness, blurred vision, nausea, and vomiting. A few nursing diagnoses for bronchitis include ineffective airway clearance related to excessive thick mucus as evidenced by excessive sputum. People with bronchitis have ineffective airway clearance due to excessive mucus buildup. A goal for a patient with bronchitis would be demonstrating effective coughing and deep breathing. Controlled coughing uses the diaphragmatic muscles, making the cough more forceful and effective. A second nursing diagnosis would be impaired gas exchange related to inflammation of the bronchioles. When someone has bronchitis, they might have impaired gas exchange due to poor ventilation perfusion. The goal for this patient with this nursing diagnosis would be to maintain clear lung fills. Teaching the patient how to use an incentive spirometer will help in maintaining clear lung sounds. The third nursing diagnosis would be fatigue, related to increased oxygen demand. When someone has bronchitis, they might feel more tired easily. A goal for a patient with this nursing diagnosis would be to determine how much activity the patient can tolerate. As the nurse, you should teach the patient energy conservation strategies. These strategies can decrease the amount of energy used by the patient. Some potential complications of bronchitis include pneumonia, chronic bronchitis, and COPD. Pneumonia is the most common complication of bronchitis. Bronchitis, although usually viral, can be caused by an infection that causes the airways to become inflamed. If the inflammation and infection are not resolved, it can spread further into the lungs. This infection then causes the alveoli to fill with fluid. These fluid-filled alveolar sacs are called consolidation. X-rays are then used to diagnose pneumonia. The X-rays are typically clear in bronchitis. Acute bronchitis can develop into chronic bronchitis, which is essentially just persistent bronchitis. Chronic bronchitis is defined by Lewis as the presence of cough and sputum production for at least 3 months in each of 2 consecutive years. When chronic bronchitis continues over the years, it is thought that the condition may precede airflow limitation development. Chronic bronchitis causes chronic inflammation and irritation that damages lungs and airways. This chronic damage can lead to the diagnosis of COPD. Previous definitions of COPD actually list both chronic bronchitis and emphysema. However, these conditions are no longer considered a part of the COPD definition and only explain the airflow abnormalities that precede the diagnosis of COPD.
Bronchitis! Nobody got time for that. That brings us to an end, guys. Thank you for tuning in. Hope you enjoyed watching and have a great day.